Good morning from UN City in Copenhagen. My name is Katharina de Kat. I'm a Communications Officer here at the WHO Regional Office for Europe. Thank you for joining our special press briefing today on World Polio Day. Today our press briefing will be focusing on the urgent importance of vaccination against polio, COVID-19 and influenza. Before we get started, just a quick word on masks. COVID-19 is still with us. It is still a threat. We are not wearing masks today in the studio because we were able to maintain physical distancing. And before I hand over the floor to our Regional Director, Dr. Hans Kluge, for his opening remarks, I would like to introduce the panel that we have with us today. Starting with our special guest, Ms. Jennifer Jones, President of Rotary International. Warm welcome, Jennifer. We also have in the studio with us today Dr. Siddhartha Datta, Regional Advisor for Vaccine Preventable Diseases and Immunization. Online, we have with us Dr. Catherine Smallwood. She's the Senior Emergency Officer and the COVID-19 Incident Manager. Without further ado, I would like to now hand over the floor to Dr. Hans Kluge for his opening remarks, followed by opening remarks by Ms. Jones. Dr. Kluge, you have the floor. Thank you.
Good morning, good afternoon. Today is World Polio Day, and this year we mark a momentous achievement. 20 years of keeping the European region free from indigenous wild polio, since the region was declared polio-free in 2002. This is truly a success to celebrate. Back in 1980, there were almost 2,700 confirmed cases of polio in the 53 countries of the European region. And 18 years later, the region's last case of indigenous wild polio was reported in Turkey. Thankfully, owing to vaccination, polio is on the verge of becoming a story of the past. Globally, polio cases have fallen by 99% since the 1980s. We stand on the cusp of eradicating polio, which would make it only the second disease after smallpox to be consigned to history. Yet our progress and the European region's polio-free status remain vulnerable. Over this past year, we have been confronted with poliovirus in Israel, Ukraine and the United Kingdom, where circulation of vaccine-derived polioviruses has been confirmed. Vaccine-derived poliovirus refers to a strain of the virus that has mutated from a weakened strain originally contained in the oral polio vaccine. Such vaccine-derived poliovirus can spread in pockets of under-immunized persons, thus making it paramount to ensure high vaccination coverage in all population groups. The linkages between the vaccine-derived virus strains recently detected in countries in the European region and in New York, as well as the recently closed polio outbreak in Tajikistan caused by virus circulating in Afghanistan and Pakistan, clearly highlight that until polio is eradicated, every country will remain at risk of polio reinfection. The polio outbreak response in Tajikistan clearly demonstrated what a strong commitment by the government towards the health of its population can achieve. I myself will be in Tajikistan next week as the government moves forward to provide the benefits of the pneumococcal vaccine to its children. With changes in travel, migration and climate patterns in our interconnected world, ensuring everyone, everywhere is protected with vaccines becomes even more essential. Today, with the prospect of a polio-free world incredibly close, I call upon health authorities and partners across Europe and Central Asia to keep up the investment and hard work maintained over decades that have brought us so far, and to stand firm in your commitment to reach the finish line. Leaving the racetrack now would be a tragedy for all of us and future generations. The European Immunization Agenda 2030, endorsed by all 53 member states in the European region, maps our course to sustain our region's polio-free status and help achieve global polio eradication. I am so very delighted that Jennifer Jones, President of Rotary International, is with us today. For decades, Rotary International has worked tirelessly in the fight against polio through its national and local chapters worldwide. In addition to the support to achieving polio-free status in Europe, Rotary, a dedicated member of the Global Polio Eradication Initiative since its inception in 1988, has played an immense role in attaining a polio-free Africa in 2020. The fight against polio has clearly demonstrated the wonder of immunization. But this is not something we can take for granted. For almost 3 years now, as health authorities have battled the COVID-19 pandemic, essential services, including polio and other crucial immunization programs, have paid a price. Across the WHO European region, coverage with the third dose of polio vaccine fell by 1% from 2019 to 2020. In 2021, only 25 of our region's 53 countries had reached the 95% or over polio vaccination coverage rate that WHO recommends. Let me turn to COVID-19 now. To date, our region has seen over 260 million cases and 2.1 million deaths, and we have administered more than 1.6 billion doses of vaccine. Last week in our region, we marked 1,000 days since the first COVID-19 cases were reported. We are going now into our third pandemic winter, but we are better equipped than ever. As we forecasted, an autumn surge has led to a tripling of regional cases since early September. In the second week of October, the European region accounted for almost 60% of new global cases and 42% of new global deaths. But this surge has not led so far to the previous levels of severe disease. Deaths and ICU admissions have only seen small increases, nor we have seen the crippling effects on the economic or social life. But this is not a time to relax. In the past month, we have also seen an early spike in seasonal influenza cases, leading now to increased positivity in patients hospitalized with severe acute respiratory infections. With COVID-19 and seasonal influenza co-circulating, the health of vulnerable people, including the elderly, the immunocompromised, pregnant women and newborns, is at great risk. So we must continue to do our utmost to prevent infections, protect the vulnerable, and prepare our health systems to manage multiple threats. Vaccination remains one of our most effective tools against both flu and COVID-19. And I urge everyone who is eligible to get their influenza vaccine and COVID-19 booster vaccine as soon as possible. Vaccines are safe and vaccines work. For polio, as for COVID-19 and influenza, vaccines can and do save lives. The other main COVID-19 policy responses are continued surveillance and securing access to antivirals for at-risk populations. On this World Polio Day, let us celebrate our success in immunization as a whole and commit to staying the course. We will take your questions shortly, but first let me turn to Jennifer Jones. Dear Jennifer, the President of Rotary International. The floor is yours.
Thank you, Dr. Kluge, and happy World Polio Day to everyone. It is a delight to be able to spend World Polio Day in Copenhagen here today. And I'd like to begin with a small piece of history. I want to take you back to 1979, when one person in the Philippines said that and challenged members of our Rotary organization to say that we can eliminate polio off of our island nation. They worked hard for many years, but it was able to be done. Then the challenge was shared with the rest of our Rotary family, 1.4 million members around the world, to say if we can do it here, can we do it everywhere? At that point in time, as we began to talk with other health professionals and organizations across the world, it was thought to be improbable. It was thought to be something that wasn't possible at all. However, we began in 1988, as you heard, to collect partners, the WHO, UNICEF, the CDC, the Bill and Melinda Gates Foundation, and Gavi, the Vaccine Alliance. And since that time, we have worked as the Global Polio Eradication Partnership together to ensure that we all bring what we bring best to the table. For us, as our Rotary family members, what we bring is advocacy. We are leaders, community leaders in our communities, problem solvers. And so we reach out, we work with our governments to ensure that the dollars that are required to eradicate this disease are placed forward so that everyone in our world can be safe. We're also fundraisers. We've raised collectively, our membership, since that time, $2.6 billion towards this effort. And so just last week at the Global Polio Summit, where the pledging moment took place to ensure that we have the funds to complete this task, we were able to put forward our next pledge of $150 million. During that time, $2.6 billion was pledged, and the $4.8 billion gap that we have to fund total eradication by 2026 is halfway to that mark. Many governments of the world have stepped up to say that they believe and trust that our partnership is going to accomplish this task. And I'm very proud of the creative ways that our Rotary members around the world every day, and particularly on World Polio Day, are raising funds through many, many means. They're pedaling for polio, they're raising pints for polio, holding fundraisers and auctions, raffles and dinners, all different methods of making sure that each person individually can do something to contribute to our polio effort. One of the best things that I think we need to take away from where we've been and what we've accomplished is the incredible public health infrastructure which has been created through the Polio Eradication Initiative. Along with our partners, we have created this infrastructure in dozens of countries around the world. And when the COVID pandemic hit, we were able to take our frontline community health workers and transit them into being frontline COVID workers because they understood the critical nature of surveillance, contact tracing, the exact things that needed to be done to be able to address COVID. But it's so much more than that. Polio for Rotary is our #1 corporate priority, and we will not walk away from it until this is resolved. But we also know that we call it Polio Plus because we're able to utilize that infrastructure to also make sure that we tackle other things like diarrheal illness, tetanus, all different kinds of tuberculosis, all different kinds of things, measles, that are taking place in real time. And so together with our partners, we're immensely proud of the progress that we've made. We are closer than we've ever been before. And while we see some setbacks, we knew that there would be some bumps along the way. But science tells us that we are tracking and tracing like we did when we were able to remove the endemic countries of India and the entire African continent 2 years ago. And we see that the 2 remaining countries of Pakistan and Afghanistan are trending and tracking in the exact kind of way. So we need to believe in science. We need to know that the cases, even though we see them in other parts of the world, are traceable, trackable, right to those original sources. And so, like I say, we are closer than we've ever been before, and I am delighted that we have an opportunity to be able to celebrate with our WHO partners in Copenhagen during this time, and look forward to being able to receive questions from any of our audience today. So thank you very much for your kind attention.
Thank you very much, Dr. Kluge and Ms. Jones, for your introductory remarks. I would like to now move on to the question and answer portion of this press briefing. And I would just like to remind everyone online to please, if you have a question, raise your hand so we can call on you. And then when we do call on you, please give your full name and your media outlet. Thank you so much. I would like to also start now with a question that was submitted in advance of the press briefing. And this one is moving on towards the COVID-19 topic. The question is, what is the forecast for COVID-19 for the coming months? And I would like to give this question, please, to Dr. Kluge. Thank you.
Thank you. Maybe first to start to tell that this virus has surprised us more than once, so any forecasts are a bit tricky, but as was mentioned in the statement, we are definitely much more better prepared. Overall, I would say there are two likely scenarios. The first one is that there is a continued emergence of sublineages of the Omicron variant, coupled with the winter seasonality, which is going to have a further increase of infections, but not necessarily deaths. And here the main policy responses are the second booster, particularly for the vulnerable groups. Second, strengthen surveillance so that any country is able to pick up quickly if a worrying variant would appear. And then the third one is access to antivirals for the vulnerable people, to keep those people off the ventilator. Of course, the caveat is the second scenario. If another, let's say, more threatening variant emerges with a escape to the vaccine, and then of course stricter policy responses would avail. And that's again why the surveillance is so important.
Thank you very much, Dr. Kluge. I would like to now pose another question that was submitted in advance, and this one reads as follows. You mentioned that there are people who should get both the flu vaccine and the COVID-19 booster shot. Does this apply for everyone, and should they be given at the same time? And I would like to pass this question to Dr. Datta, please. Thank you.
Thank you so much for that question. Indeed, I think as we heard our regional director say in the introduction statement, at this point of time, we do expect that flu and COVID-19 coexist. And in this setting, the most important element is to protect our vulnerables, the elderly, people who are with underlying disease conditions and immunocompromised. And this is the same group that we have seen over the years, the flu virus attacks, and they land up into the hospitals. They are the critically vulnerable patients that we need to protect. This is also important that we keep our health system capable to take care of the people who would eventually land up into the hospital. Hence, these two groups, the elderly, the immunocompromised, also the pregnant women, is very important to be protected, both with influenza as well as with the COVID-19 vaccines. Thank you.
Thank you very much, Dr. Kluge. And we have a bit of a follow-up question also on the polio topic. The question is, how concerning is it that polio is appearing in places like New York and London, which have relatively high vaccination coverage? Is this a significant setback for global eradication? And for this question, I would also like to go to Dr. Datta, please. Thank you.
Thank you so much. I think the most important element is that we need to understand the occurrence of the vaccine-derived polio or wild polio virus cases in any communities anywhere in the globe clearly indicates one thing. We have left our children behind by not getting them vaccinated. That is critically important. The reasons could be multifactorial, the reasons could be context specific. But I think it's important that we understand that anywhere in the globe, if we have left people behind, the polio virus is a very good barometer to tell us who are they. Either it's in New York or in Israel or the United Kingdom or in Ukraine, the underserved population groups, because of one reason or the other, did not receive the recommended WHO target of 95% coverage. I think it's extremely important that those communities which are adequately protected, the virus will find it hard to find its own claws. So whether it's in New York or in other 3 countries in our region, it's extremely important that every child gets the vaccine doses which are part of the national vaccination schedule. And we attain the 95% coverage, which will definitely allow the virus not to find its place. The other important element is we need to understand why people are not getting vaccinated. This will allow us to understand what local level intervention, which is tailored to the local setting, need to be implemented in each of these areas. And the Global Polio Eradication Initiative, together with the Rotary and WHO, we just do that. We look into what are the local factors which will allow us to reach to that last 5% or last 10% of the last step. And I think this is an important element. And today, at this World Polio Day event, this just reiterates the fact that the vaccine needs to reach everywhere. And if it is not reaching everywhere, the virus will tell us that we did not do our work. So let us all get united in this effort today during the World Polio Day. Thank you.
Thank you very much, Dr. Datta. And I would like to ask a follow-up question that was posed for Ms. Jones. If she could also comment on the work that Rotary is doing at the local level to really, we know that you've discussed the global huge impact, but also how Rotary can help, specifically what Dr. Datta was speaking to is the issues at the local level. Thank you so much.
Thank you very much for the question. I think one of the most important factors is, from our organizational standpoint, is that we exist in more than 200 countries and geographical areas, and so we have a footprint quite candidly across the globe. One of the things that we know is that seeing cases outside of the endemic areas is concerning, and we need to recognize that. But I think we also, certainly within our own membership, while we don't want to fearmonger, we need to utilize the opportunity to continue to raise awareness. And in the communities where we've seen, as has been mentioned, London, New York, in parts of Africa, cases that have been contained and identified, it gives us that opportunity to raise awareness of what polio is and why it's important for us to eradicate this disease. And for many people in many parts of our world, it's been decades since polio has been on the forefront and part of the dialogue in a community. And so for us to be able to harness that, to be able to utilize that, is critically important. And so as a global organization, we're using this to our advantage to make sure that people understand that polio anywhere is a threat everywhere. And so we need to be able to make sure that that every child is vaccinated, no one is left behind. And on a day like today, it gives us that extra boost of being able to raise that critical awareness.
Thank you very much, Ms. Jones. And we have a final question now, and this one reads, has the surge of COVID reached previous levels of severe disease? And is it because of the new BQ.1 variant? And I would like to pass this question on to Dr. Smallwood, please. Thank you.
Thank you very much, Katerina. So as the regional director mentioned, we have seen a surge in COVID-19 cases with the autumn season, people moving indoors. And that's certainly driven in part by the continued evolution of the SARS-CoV-2 virus. And what we're seeing at the moment is quite a range of different sublineages of Omicron. They're all descendants of Omicron circulating at the same time. And at the moment, what we're having trouble doing is really isolating which of these variants will have that growth advantage in comparison to the others and will take over in terms of dominating the spread. So we need to watch out, and this is what the regional director highlighted. We need to continue the surveillance, really keep a very close eye on these different sublineages. And we've got to ensure that patients are detected early, and those who are potentially vulnerable to severe disease are able to access some of the countermeasures, including oral antivirals, that will prevent them from ending up in hospital. So all in all, we're seeing several different variants circulate. Some of them, such as BQ.1, have been highlighted as potentially accelerating in their growth advantage, and that's because of some immune escape to previous immunity. but we're not sure yet on how this is going to pan out in the longer term.
Thank you very much, Dr. Smallwood. We now will conclude our press briefing for today, and I would like to remind journalists online that the Dr. Kluge's statement will be sent by email. You also are also very welcome to submit questions at any time to the eupress@who.int inbox, and we'll be very happy to get back to you to respond to your questions. Thank you so much for today. Stay well. Thank you. Goodbye.